Chapter 35, Dental Handpieces and Accessories. When attached to a specific handpiece, rotary instruments operate at different speeds to accomplish different functions in the cutting, polishing, and finishing of tooth structure in the restoration process. Evolution of rotary equipment. In the 1940s, the introduction of rotary instruments, belt-driven handpiece, and developed the diamond cutting burs. In the 50s, invention of the tungsten carbide and development of air-driven turbine handpiece. Dental handpieces. The dental handpiece is the most frequently used instrument in restorative dentistry. It provides power to a rotary instrument that is used to complete the actual cutting or polishing of tooth structures and castings. The low-speed handpiece ranges in speed from 5,000 to 30,000 rotations per minute. The rotary instrument or the burr can be positioned to operate in both forward and then backward movement. It can be adapted with straight handpiece attachment, the contra angle handpiece attachment, and the prophy attachment. Uses of the low-speed handpiece. Clinical, removal of soft decay and fine finishing of a cavity preparation, finishing and polishing of restorations, corneal polishing and removal of stains, porcelain adjustments, and root canal treatment. In laboratory, we can use the slow-speed handpiece for trimming and contouring of temporary crowns, trimming and relining of removable partials and dentures, trimming and contouring of orthodontic appliances. The high-speed handpiece design is a one-piece unit with a slight curve. It's operated by air pressure and operates at speeds as high as 400,000 RPM, maintains a water coolant system, friction grip locking system for rotary instruments, and a fiber optic light. Uses of the high-speed handpiece include removal of decay, removal of an old or faulty restoration, reduction of a crown portion of a tooth in preparation for crown and bridge, preparation of an outline and retention groove for new restoration, finishing or polishing of a restoration, and sectioning a tooth during surgery. Burr locking systems. Burrs for high-speed handpieces have a different locking system than those for low-speed handpieces. High-speed handpieces operate with a friction grip device. Some older handpieces require the use of a burr changing device. For others, with a release built into the head of the handpiece, burr changing device is not required. Laboratory handpiece operates at a speed as high as 20,000 RPM, uses laboratory burrs, and has a greater torque than the handpiece that would be used intraorally. Ultrasonic handpiece is primarily used for scaling and root planning. It attaches to the dental unit for water or has its own self-contained water or Medicaid supply. This is powered by electricity. It's used for scaling and root planning and also prophylaxis appointments. Attachments similar in appearance to scaling instruments and delivers a pulsating spray of water. Laser handpiece uses a beam of laser light to cauterize soft tissue or vaporize decayed tooth structure. The resemblance of a standard handpiece, water to cool and water and air to cool the tooth and keep the area clean. Benefits include that it's painless and not having to wait for anesthesia to work. Precautions of laser handpiece: do not sharply bend or twist the fiber optic cable. Do not touch the exposed fiber optic cable. Do not touch the end of the fiber optic cable's connector, and keep the connecting parts clean. Air abrasion handpiece is a smaller version of a sandblaster designed to remove stains and tooth decay. High pressure delivery of aluminum oxide particles through a small probe removes enamel dentin and restorative material without compromising healthy tooth structure. Uses of the air abrasion handpiece include preparation of teeth for sealants, removal of external stains, Class 1 through Class 6 preparations, endodontic access, crown margins, preparation of tooth surface for cementation of a cast restoration, like a crown or veneer. Other hand pieces include implant, endodontic, and surgical. Handpiece maintenance, general considerations, wear personal protective equipment and follow universal precautions. Clean debris from the external surface. Clean the internal components of the handpiece. Handpiece must be dry before being packaged. Wrap the handpiece for sterilization. Sterilize the handpiece. Wipe the light port on the fiber optic with an alcohol swab to remove any excess lubricant. Rotary cutting instruments. There are 3 basic parts to the rotary instrument. The shank, the portion that fits into the handpiece, could be straight, latch type, or friction. The neck, the portion of the rotary instrument that connects the shank and the head. And then the head, the cutting, polishing, or finishing portion. All rotary instruments with sharp cutting heads include preparation of the tooth, excavating decay, finishing cavity walls, finishing restoration surfaces, removing old fillings, finishing crown preparations, separating crown and bridge, adjusting and correcting acrylic temporary crowns. When discussing the shape of a burr, you are referring to the contour or design of the head of the burr. Burrs are manufactured in a variety of shapes, and each shape is available in a variety of sizes. A burr will have a name, a series of numbers attached to its shape, and a purpose for use. Diamond rotary instruments. Diamond burrs are often used for crown preparations. Most frequently selected diamond burrs include the round, the flat end taper, the flame, and the wheel. Finishing rotary instruments. A finishing burr is similar in appearance to the cutting burr, except the number of blades or flutes in the working end of the finishing burr is increased. The greater the number of cutting surfaces on the head of the burr, the greater it is at polishing and finishing. Tapered, round, or flame-shaped. Abrasive rotary instruments are the most varied of rotary instruments. Many types of abrasive material are applied to many shapes to create a flexible working surface that can be adapted to the contour of a tooth or restoration. Its abrasive materials are made in shapes ranging from discs and stones to points and strips. Abrasive discs and wheels are supplied separately and not attached to a shank. A mandrel is used to attach the abrasives to the dental handpiece. Mandrels are designed according to the different types of shanks so that they may be used in both low and high-speed handpiece. Laboratory rotary instruments have a longer shank and a larger head than dental burrs. They are used in a low-speed handpiece for functions such as cutting and polishing of acrylic. The acrylic burr is the burr that is most commonly used in the laboratory.